Well, good afternoon, and thank you for joining us. You've landed at the CAHF COVID Monthly Roundup, and my name's Jason Belden. I'm the Director of Emergency Preparedness with CAHF, and normally we have Patty join us for these calls, but she's got a conflict today, so we're doing double duty. So it's just going to be me today. Today is October 29th. It's 2021. It's 1 o'clock in the afternoon. Generally, we take about an hour to go through these webinars. This month, there hasn't been a huge amount of changes, and the ones that are big changes, we'll cover those on this webinar. But I'm guessing that most of you have already taken action on these, but if not, hopefully this will give you some help. And we've got some handouts as well to go with the presentation today. So let's dive right in. All right. So this is a general introduction. The speaker's opinions expressed on this webinar are their own. They may not reflect CAHF's official position. These webinars are brought to you as a part of a grant-funded program with the California Department of Public Health and the Los Angeles County EMS Agency. I have no personal financial conflicts, and I will be the only speaker on this webinar. The intent of the webinars is to give you a situational report of what's currently going on with the COVID response, some forecasting when we can on what's likely to be coming down the road, and best practices where we can identify those. All right, so let's hop right in. Big news is the CDC expands eligibility for COVID-19 booster shots. And we talked previously about the Pfizer booster doses as well as the Pfizer third dose for the immunocompromised folks. The CDC and the FDA both jointly approved the Moderna vaccine booster shots. And the way that it breaks down for the Pfizer and the Moderna booster shots are virtually the same. So the following groups are eligible for a booster shot at 6 months or more after their initial series. So anybody who's 65 and older, anyone age 18 and over who live in long-term care settings. So that applies to both SNFs and ICFs. So if you're an ICF, it definitely applies to your clients as well. Anyone 18 and up who has underlying medical conditions, anyone 18 or up who work or live in high-risk settings. So it's pretty much anybody that lives or works in in long-term care is eligible to get the booster shot. And now if you have folks that received Johnson & Johnson, there's about 15 million people across the United States that received the Johnson vaccine. The booster shots are also recommended for those that are 18 years or older and who were vaccinated 2 or more months ago. And so that's a little bit different timing than the Pfizer and Moderna booster shots. All right, now I borrowed these slides from Dr. Horn. I didn't want to recreate the wheel, and I thought they were really good, so I'm just going to go over her slides. If you've already listened to this on Wednesday, my apologies, but this encapsulated it as best as I could find. So considerations for people in the may category. So the should category, all of our residents should be getting a booster dose. That's pretty clear from the thing. And then where it says may, that would be those that work in our settings. Now, we have been told that they're not going to change the definition of fully vaccinated, but I'm not certain that's set in stone. It's possible that with a little more information on the booster effectiveness and waning immunity from those who choose not to get a booster, I think if we start to see data that would indicate a real reduction in immunity, then there could be a change to the definition of fully vaccinated. And we know from other vaccines, they're done in series. And so sometimes like, a Hep B vaccine where you have to come back in multiple times as a part of a series, we may have that happen for us. And we don't know that yet, but for right now, all your staff are in the may category. So they may get the booster shot. Should get the booster shot as your residents and clients for sure. things to consider when deciding whether to get a booster shot is the risk of exposure. If you live or work in a communal setting, and it doesn't matter long-term care, if you worked in a prison, or you worked anywhere where people are congregated in an indoor environment, I think that's a higher exposure to COVID. Risk for severe infection related to underlying conditions, definitely very, very, very important in the potential impact of SARS infection. So those are all things that you should consider, if you're looking at it for yourself. For certain, I think there's value in all of us getting it. Some of the initial studies that were done as it relates to waning immunity, there's some pretty compelling evidence that would say it's not a hard and fast rule that your immunity drops off at a certain point. We're all individual people, but at some point the immunity will wane for, it appears, most people. So to what extent that wanes, we don't know. I don't know that we have a way to quantify that yet, but it's definitely a pretty significant reduction in initial immunity after about 6 months. So I will say that the CDC released an MMWR this morning that would seem to indicate that reinfection from COVID is more likely than having a breakthrough infection and those leading to hospitalization. So I haven't read through the entire MMWR this morning, but it would seem to be like, if you have staff that say, look, I've got natural immunity because I had the virus. What this MMWR has basically said, yes, you've had the virus, but you can get the virus again. And when you do, you're 5 times more likely to go to the hospital than you would if you were vaccinated and you got a breakthrough infection. So I think there's compelling reasons to continue to encourage people to get vaccinated. I'll get off my soapbox, but in terms of the vaccine booster doses, both the Pfizer and Moderna are 6 months after the primary series. And notice that asterisk at the bottom. The booster dose for Moderna is a half dose. And I'll give you a guide on a couple more slides here, and you'll see that better clarified. And then for the FDA authorized Johnson & Johnson vaccine, it's 2 months after the primary series. All right, choosing the booster vaccine. And this one's important. There's a lot of questions that I've seen on the HSAG calls, and I'm not certain that there was a lot of clarification given to this, but eligible individuals may choose which vaccine they receive as a booster dose. So that is completely on the option of the person getting the vaccine. They should consider the risks and benefits of each product and go through the risks and benefits of each one and discuss with their healthcare provider. If they're a staff member, they should talk to their doctor about it to see which one they feel is best for them. And your medical director should be walking the residents through what is the appropriate vaccine for them. That's provided you have the opportunity to utilize multiple vaccines. If you only have one vaccine product available to you and that's the only one you can source, then obviously you're going to go with that one. So homologous boosting using the same product as a primary series does increase the immune response against COVID-2. And acceptable safety profile for all of the vaccine boosters. And notice the half dose of Moderna in there. In terms of heterologous, I can't say that word, forget about it. I could barely put 2 words together. Mix and match boosting, that's easier for me. Using a different vaccine for a booster dose than what was used for a primary series. Now that is allowed. I don't know that they strongly encourage it or not, but it's certainly allowed. All COVID-19 vaccine boosters lead to a strong serologic response in groups primed by all 3 vaccines. Use any COVID-19 vaccine, use of any COVID-19 vaccine will boost immunity. I will say that based on our resident population, I would almost certainly concentrate my efforts on one of the 2 mRNA vaccines, but that's just me. I think data has borne out that they're clearly much more efficacious in preventing severe disease. And the timing of the booster shots is always based on when they finish their primary series. So once they hit that 6-month mark, they're clear to get a booster shot after that. All right, so here's the product guide. I'm not going to go over this in depth, but I wanted you to have the infographic in case the HSAG doesn't upload the slides until next week. But in any case, this is available and it's part of the handouts today. And it goes over the dosaging, what the packages look like, what the administration is, and what the storage requirements are. So very in-depth information, quick guide to get folks to it. And I had written an article in the CAHF e-news about a toolkit that CDPH was putting together, and they finalized the toolkit that is up on the website, and I also included that as one of the handouts today. And it really walks you through if you don't have the capacity to vaccinate yourself, here are resources in each county which could be of assistance to you. Really, I think obviously there's work in sourcing this stuff, but it's well worth their work, for one, and for two, I think they've got a lot of resources in there that should be able to connect you with the ability to vaccinate both your staff and residents. All right, and here's some links to those guides. The interim clinical considerations for all the COVID-19 vaccines, the booster eligibility, the vaccine eligibility, the product guides, and the vaccine toolkit are all linked right there. All right, I know that was quick. I got through all that stuff in 2 minutes here, basically, or 5 minutes, or whatever it was. Also, as a part of the handout, there's a one-pager that has, by age group, the dosage, when they should get a dose, who should get a dose. I like the one-pager. It's from from Dr. Horn. I included it in the handouts today, and I think that's probably the easiest way to figure out who gets what and when. Just a quick, fast, easy way to get through that. All right, so just to let you know, Patty and I met with CMS Region 9 on Wednesday, I think it was, and they were looking for a short turnaround on feedback for 1135 waivers and extensions of the public health emergency. So the public health emergency was extended until January. And the way the PHEs go is they give a 90-day extension. So our advocacy to CMS was we definitely need to keep the PHE extension in place. Without it, we would lose our rate increase and some of the funding that is really assisting us right now. We also advocated to keep a majority of the 1135 waivers, especially the ones that have to do with physical space and three-day qualifying stay. There are a number of other things. If folks are interested in what we're advocating for both nationally on the 1135 waivers, please send me an email, and I'm happy to give you what we sent to CMS. It's really wonky stuff, but if folks are interested, I'm happy to send that along. Now, at that Region 9 meeting, we have folks from Washington State and Oregon, Arizona, Hawaii, and Alaska. And the good news is, I don't meet with the CMS Region 9 folks very often, but this was it was actually refreshing. Like it seemed like they were very responsive to our request. Every one of us from all of the states all requested the same thing, and my hope is it's going to continue for another 3 months after that. In April, maybe we'll start looking at when this is going to wind down. But I want you to think about this for your planning purposes. That reimbursement, those extra reimbursements, there's going to be a cutoff to that, and at some point that spigot is going to turn off. And I don't think it's going to be January, but it could be April of next year, depending on how we seem to pull out of this latest surge. So anyways, if you want a copy of the news release that CMS put out on the public health emergency, there's a link to it there on the top. All right, I want to talk to a second. I don't know if folks saw this. I'm certain you're already putting this into place, but this is the one AFL that did come out earlier this month, and it changed. It separated, or it put all of the. It took the SNF residents out of the guidance in AFL 2108, and then put all of the SNF quarantine guidance into 2053.5. So when you're looking at quarantine guidance for an exposure or things like that, if it's a resident, you're going to look at AFL 2053. If it's for staff, we're going to look at this AFL 2108. Now the AFL's changed to reflect the updated CDC guidance. One of the main things here is during a critical staffing shortage, asymptomatic unvaccinated SNF healthcare personnel may return to work after day 7 from the date of last exposure if they've received a negative PCR or other molecular test result from a specimen collected on day 5 or later. So that's a pretty big departure from a hard and fast 14 days. There are also allowances for vaccinated staff to continue to work. I'll give you the language that they say, because I've had some questions about this, and local health departments or surveyors going, why is this person not off work? And so I'll just read this. For fully vaccinated skilled nursing facility healthcare personnel with higher risk exposures who are asymptomatic do not need to be restricted from work for 14 days following their exposure. Work restrictions for fully vaccinated healthcare personnel with higher risk exposure should still be considered for quarantine if they have underlying immunocompromising conditions, which might impact the level of protection provided by the COVID-19 vaccine. So that's a pretty big departure, and that it's I've seen some surveyors ask questions about why that staff member was not isolated, and just know that the language is right in their own AFL. All you have to do is pull it out and give it to them. Now, the caveat here is a local health department has a separate jurisdiction, and they may go, nah, we're not comfortable with that. We're going to issue a public health order, and we're going to say this is what we want you to do. And if that's the case, as always, we've got to go with the local health department if it's more conservative. But if it results in access to care issues or other things that could put residents at risk, in your opinion, from a lack of staffing, please reach out and let us know so that we can advocate to the health departments that there are two sides, and sometimes we need to have these folks at work. All right, so not a lot we can do about that if the health department, says, no, you've got to quarantine for 14 days after high risk exposure, or 10 days, or whatever it is that they choose to do. All right, I want to hop to just a quick thing on Los Angeles County. They have a telebriefing this afternoon, and there's a link to the invite, but this is a call-in. I don't know if they have a webinar scheduled at the same time, but I only got a link to the call-in information. And for those of you in LA County, if you're a subacute, we sent in an emergency power survey on your generators. LA County has a grant to assist the subacute providers with older or aged, let's say, emergency power systems, and we're trying to gauge what the capacity is at the subacutes within the county. So if you have a subacute, I sent an e-power or a survey over to you. It's a one-page survey. It shouldn't take more than your maintenance person 5 or 10 minutes to fill it out. the good news is we may find funding to be able to help you replace or repair some of those things. That's not going to happen if you don't respond to this. So if there's possible money on the back end, please, it's within your best interest to respond to that. Not in any case, I know it doesn't apply to everybody, but if you're a subacute in Los Angeles County, please reach out to me. And then on Wednesday's call, or Thursday's call with CDPH, we had, and this is an ongoing thing, the issue of non-emergency transport providers coming in and refusing to be tested, provide proof of vaccination, or be symptom checked even, and or screened at the door. We need feedback on the names of those companies, and I will take any reference to who you are as a provider, but the folks from local health departments are reaching out because they're really they're really upset with that, and they want to reach out on your behalf, not say, you know, so and so nursing facility called me and said you're doing this. They're going to say, hey, listen, when you go, this is the expectation, and there's no exceptions. So let them be the bad guy, and let us advocate. Let them advocate for them to get their staff in line to be screened, tested, and or provide proof of vaccination. So we need that information. So please respond to me now, or send me an email and let me know. There's one other thing that has come up, is this global supply strain, and it's not necessarily that products are not made, its products are being held in places, and there's, you know, logistical problems getting them in and off ships. We've all seen the news stories about the ships parked off the coast. The county MOACs have all kind of reached out and said, hey, listen, we need to know if you guys are struggling to find certain types of supplies so that they can try to proactively go out and source things that they think are lacking in the private sector. And so, and please be detailed in your response back to me. I have not heard a bunch about PPE except for gloves. If you guys are having issues finding gloves, please, you know, either email me or put it in the chat or the comment box here, either ones. If you have stuff, I don't know, saline, no matter what it is, if it's a medical supplies that you have backed up, that you're having a hard time trying to find, please reach out to me and let me know. I don't need to know your company. I just need to know the types of products that folks are struggling to find. So appreciate your help in helping us prepare the state for what's to come next. All right, guys, that was about it. Not a huge amount of changes this month. I try to keep these to just changes so I don't waste your time. I try to only talk about COVID so that you can take time to go do other stuff. Please, if you have questions, I don't have any questions in the chat box today. I'm gonna wait a couple more minutes for questions, and hopefully, well, oh, here we go. I got a question. Yay! All right. When verifying vaccination status for visitors, is it also mandatory to record the date the vaccination was, or does the mandate simply require proof of vaccination? Yeah, Kevin, that's a great question. On the order, it just says proof of vaccination. I don't know that you need to record the date the vaccination was issued, as long as you're recording that you have verified there's proof of vaccination. Maybe at some point, if that changes to when, you know, whether there's going to be a difference between what's fully vaccinated and what's partially vaccinated, then maybe, I don't know. But as far as the public health order and where we stand now, no, you do not have to put the date on your recording. All right. Well, I want to tell you guys, I hope you have a wonderful Halloween. Hopefully you dressed up for work today, or maybe you didn't. Everybody's wearing a mask, I know that. So, but hopefully you enjoy your Halloween weekend. We will, I don't know how much we'll have to talk about at the end of November. The surge is way down, transmission rates are way down, cases are way down. It's all great news. It's going in the right direction. I think there's a bunch of uncertainty about when we're going to, quote unquote, end the pandemic. But for right now, things are looking fantastic across the state. I will say the boosters are really important, because if you look at the anatomy of some of these outbreaks, it's clear that when you do get an outbreak, they're starting to become larger in size. The great news is that really severe symptomatic disease seems to be mostly gone, and that's great news. But I think as immunity wanes, it's really important for our residents to get these booster shots. So hopefully that's you got an action plan for getting that done in the next month. And if you have questions about that in any way along the way, you don't hesitate to reach out to me or Patty or Claire or Deanne or any of us. And hopefully you have a great weekend. We see you at the CAHF annual conference in the middle of November. Take care, everybody. Have a great weekend. Thanks so much.